Hello and welcome to another health talk. This is going to be my second and hopefully final talk about the keto diets. If you watched my previous one, you should have a basic understanding of the different keto diets. So I'm not going to explain in much detail at all what a keto diet is. So let's start with what a diet is. But before we do that, please remember I am not a medical professional. I am not a scientist. I'm simply an educated man learning as much as I can about medicine, health, proper diet, and lifestyle, and sharing what I have learned with you. I watch a lot of videos, I read a lot of stuff, and sometimes it can be really confusing. If you need medical advice, please seek the help of a medical professional. If you need help on diet and nutrition, please seek a professional who is trained in that. Most doctors, even specialists, are not trained at all or very little in nutrition. Okay, so what is a diet? A diet is how much and what you eat. Most diets that promise long-term results for short-term effort are fads and cannot be trusted. If you want a diet to succeed, it has to be part of your lifestyle, and voluntarily so. Diets high in processed foods, fast junk, ready-to-eat meals, frozen dinners, boxed food, soups, processed meats, dairy products, etc., have repeatedly been proven to destroy your health over time. Successfully changing your diet for the better requires a gradual change. Most people don't have the willpower for an abrupt one, and a dramatic increase in fiber consumption can cause diarrhea, and you have to stick to a diet for at least 90 days without cheating to see if it even works. Changing your diet for a few weeks is foolishness. Okay, if I might point out, if a doctor keeps throwing medicine at your problems, even when your problems are caused by food, which is a very long list including diabetes, heart disease, autoimmune diseases, cancer, and so on, then the doctor likely doesn't know how to help you improve your diet, and you run the risk of long-term consequences from the bandage effect of the meds, as well as the potential side effects of the meds themselves. When I say the bandage effect, I'm talking about if you have an infected wound and you don't wash it, you don't put any antibiotic ointment on it or anything like that, and you just put a bandage on top of it, you're not treating the problem, you're just covering it up. Okay, so briefly, a keto diet is a high-fat, adequate protein, and very restricted carbs diet of all types. These diets may rely heavily on animal-based foods, and for best results and your safety, your doctor should be monitoring your health through blood and other tests on a routine basis. Here's what you can expect on a keto diet. If you are an epileptic, which is what the diet created by Dr. Russell Wilder at the Mayo Clinic in 1923 made it for, you can expect a decrease in seizures to a varying degree, depending on other existing conditions. And if you stay on the diet long enough, the benefits will remain for an unknown number of years after you stop. And when I say long enough, I mean a certain number of years. One study that I looked at said that they were on the diet for at least 6 years. And even after they stopped, they continued to have a decreased amount of problems from epilepsy. In general, not for the epileptics, but in general, you will experience rapid weight loss, lower your blood glucose or blood sugar, lower your triglycerides, and your blood pressure. You may be able to get off some of your medications or reduce them. During the diet, some of your blood panels will potentially demonstrate higher than normal levels of cholesterol, LDLs, and other problematic markers that indicate ailments like heart disease and numerous other food-caused ailments. Doctors I've heard speaking about the topic say that it's an acceptable short-term weight loss diet, but not for the long term. This next part is based on a Virtus Health study called Long-Term Effects of a Novel Continuous Remote Care Intervention Including Nutritional Ketosis for the Management of Type 2 Diabetes, a 2-year non-randomized clinical trial. And you can find this on Frontiers in Medicine. I'll try to remember to include the link to that. The results are on the The results that I will be referencing are on Table 2, not Table 1. I'll give you the initial, first, and second year results for each marker, but keep in mind that these are means and averages, not the result of every participant. This study was not randomized. One adult group used a keto diet while the other used the American Diabetes Association's diet. What happens to you will vary. And please also keep in mind that the numbers I'm giving and the information I'm giving are based on the results. If you're way above the numbers I'm giving you, you're going to have, you're going to see a different change. If your numbers are way lower than what I'm talking about, you're going to see a different change as well. This is just from the study. The following improvements all exceed the results of the ADA's diet used by the controlled group, although they are not ideal and indicate continuing health issues, including diabetes. Your A1C will drop to high pre-diabetes between 5.7 to 6.5% level, that's pre-diabetes levels, not non-diabetes within 1 year, but will likely go back up to diabetic above 6.5% levels in 2 years. The initial average or mean that the study found was 7.7% for these diabetics, which dropped in a year to 6.3%, and then it went up to 6.7% in the second year. So, not good. You're fat, but better than the ADA's diet. Your fasting glucose will also drop in the first year, but it will most likely not drop to the normal range, which is less than 125, and it will start increasing thereafter. 163.67, and then the first year was 127.29, second year was 134.58. As a note, normal blood sugar in a non-diabetic is 70 to 140. Your blood pressure, which is normal range is less than 120 over 80, will likely drop to within the stage 1 hypertension level if it's high, and stay there. The initial was 131.7 over 81.8. First year was 125.3 over 78.1, and then the second year was 125.9 over 78.7. You can see the American Heart Association's information on blood pressure. I'll try to provide all the links for these things that I'm mentioning. Your HDLs, ideals greater than 60, will likely increase and be within the acceptable range. Initial was 41.8, first year 48.5, second year 49.5. You can look at for example, the Healthline cholesterol, LDL, and HDL page for more information. Your triglycerides, normal is less than 150, will likely decrease to barely normal in 1 year and rise slightly to borderline in 2 years. 197.2 to 148.9 to 153.3. Check the Mayo Clinic for details on triglycerides. Your beta-hydroxybutyrate will likely rise but may never come close to a ketogenic state, which is greater than 0.5. The beta-hydroxybutyrate is a marker that indicates whether how close you come to or are in a ketogenic state. The first, the baselines was 0.18, first year is 0.27, second year still 0.27, which is a little bit more than half of the desired 0.5 for a ketogenic state. And only 14.1% of patients on the keto diet in this study achieved ketosis at 2 years. A ketogenic state is supposed to confer certain benefits and is supposedly achieved by fasting for 3 to 5 days, but not longer or less. Your HSC reactive protein, which is a marker of total body inflammation, remember inflammation is bad, should be less than 1, will likely decrease but not likely to normal. They started at 7.45, went to 5.01, and then to 4.69, which is still really bad inflammation. Now, the following detrimental changes were observed and are worse than the ADA's diet and indicate health issues, including the risk of heart disease and stroke. Your total cholesterol which ideally should be less than 200, will likely increase to nearly borderline in the first year. So if they started at 184.4, went to 192.8, and then 194.1. Not the right way to go. Your LDLs, ideally less than 100, will likely increase with a good range towards borderline in 1 year. This factor has been demonstrated to correlate to your risk of heart disease. In other words, the higher your LDLs, the more likely you are going to end up with heart disease. They started at 103.5, then they went up to 114.1, and then up to 114.6 by the second year. Note that Virta Health claims to be the first company, which is a bald-faced lie, to be able to reverse type 2 diabetes. However, in the fine print, they explain that what they mean by reversing type 2 diabetes is that you will become pre-diabetic. So you're not actually reversing fully as the words actually mean. In their definition, you're just becoming pre-diabetic instead of normal, without medication except metformin. Given that metformin reduces A1C by up to 2%, this means that the reduction observed in the study may be because of the drug that all the keto patients were on, except those who had problems with it or wanted off it, instead of the keto diet itself. That's kind of sus. Further, a decrease in carb consumption with an increase in protein consumption has been positively linked to an increase in cardiovascular disease in men and women. Now, keep in mind that keto diets have you on an adequate amount of protein, but a decreased amount of carbs. A low-carb, high-protein diet increases risk of cardiovascular disease and death from it. According to the Journal of Internal Medicine, the study called Low Carbohydrate Rich Protein Diet and Mortality in a Cohort of Swedish Women, which was over 80-some thousand women. And a PubMed article, Low Carbohydrate High Protein Diet and Long-Term Survival in a General Population Cohort, which was a Greek study of over 20-some thousand men and women. These two studies are of a total of over 100,000 people. Many other studies have also demonstrated that the risks also include cancer, diabetes, and all-cause mortality, especially, I'm laughing at a typo I made in my script. It's pretty funny. It was specifically. I thought I caught all of my errors, but I didn't. Especially for diets low in carbs, high in fat and protein, meat, eggs, and dairy, as well as processed foods. Ultimately, the keto diet increases your risk for diabetes, cancer, heart disease, autoimmune diseases, and many other ailments. Another study that was that I found reference to in the JMR Diabetes, called A Novel Intervention Including Individualized Nutritional Recommendations, Reduces Hemoglobin A1C Level, Medication Use, and Weight in Type 2 Diabetes. Let it be noted that the JMR Diabetes study in the abstract's conclusion exaggerates the benefits of the keto diet as highly effective when the data doesn't support anything more than a drop to pre-diabetic levels, and that improvement is potentially temporary. Also, given that neither study is more than 2 years long, these cannot truly be considered long-term. And although they've had ample time since that 2-year study was completed to do a more long-term study, nothing has been released as of this month, May 2022. Both the JMR Diabetic and Frontiers in Medicine studies contain conflicts of interest, including grants from the food and beverage industries, as well as Virta Health, Atkins, and other diet companies. Now, Plant Chompers did an interview with, for those of you who don't know, they're a YouTube channel. They did an interview with Cyrus Kambata, PhD, and Dr. Robbie Barbaro, who have come up with a program based on their own personal experiences and research and efforts as type 1 diabetics. And their program is called Mastering Diabetes. And they've helped thousands of diabetics with their program. Chris, the guy who runs Plant Chompers, did this interview with them about diabetes, the keto diet, and Virta Health. One subscriber of the channel said that she or he was on the keto diet for 5 years and then had a heart attack. Yay! This is a very real risk of any diet that is high in fat, but especially diets high in meat, dairy, eggs, and processed foods. Sorry, lost my track there. Another subscriber decried their diet as unsuitable for type 1 diabetics, which both Cyrus and Robbie are, and swears by Dr. Bernstein's diet. But Robbie and Cyrus were able to successfully clarify why this person is mistaken. Now, I do have to mention, if you watch this video, ignore what Cyrus says about the keto diet at 45-20, starting with Dr. Atkins, having started with Dr. Atkins. I mean, he clearly didn't do any real research on that topic and shouldn't have answered that. So that's pretty much it for me. If you have questions, leave them in the comments. I'll try to get back to you. If you're going to be rude, don't bother, because I'll just block you or report you or whatever. I just hope to have some nice dialogue with people on this topic and other topics that I bring up. Thank you so much for watching, and I hope you have a great day.